Good morning.
Good morning.
My name is Marcus Grimes. I'm a 39-year-old former high school English teacher. I'm here today because if there were an affordable care plan 20 years ago, my healthcare state would be totally different right now. In fact, if there were affordable healthcare plan then, the government would not be responsible for over $22 million to be paid on my behalf in the form of health care, compensation, and rehabilitation over the next 30 years of my life. I was diagnosed with diabetes in 1989 as a freshman at Slippery Rock University, at which time I was told that in order for me to take care of my diabetes, I had to lose weight. And I lost the weight, and I began a strong, strict regimen of exercise, and I changed my dietary habits, and I moved back home to be under a doctor's care and to be with my parents so that I can receive good care. After graduating from school in DC, from UDC, I began teaching. And when I began teaching, I taught at a charter school where I was told that because of my pre-existing condition of diabetes, I would have to pay a little bit more for my health care premiums, and I would have to receive a private plan. My health care premium was $1,300 per month. I could not afford that. So therefore, I figured that since I lost the weight, my insulin had been completely reduced, that my pancreas started producing insulin again, I figured I'd just work out and I'd be uninsured. I chose to be uninsured. Unfortunately, I took a supplement that caused heart failure, and I was in the hospital, and when I was in the hospital, I noticed that I had a blur spot in my eye. When I got out of the hospital, I accrued all that debt from being in the hospital for 2 weeks. I was told by the ophthalmologist that my eye was blurry because of a detaching retina. I was also told that this could be corrected surgically with a procedure that costs upwards of $50,000. And in order for you to even schedule the procedure, I needed $3,000 down. I couldn't afford that. And I asked him, is there any way for me to get on a payment plan? He said, that is the payment plan. I left the eye clinic discouraged and dejected, and shortly thereafter I lost the eyesight in my left eye. And after that, I ended up losing the eyesight in my right eye because the Medicaid that I was given after receiving disability was moved to spin down right before I was supposed to have a surgical procedure on my right eye. And the ophthalmologist said that he would decline to have the surgery with my Medicaid not an active status. Therefore, I'm here because it is a necessity. It is a necessity that the affordable plan be allowed for all Virginians and everyone in the country, because this is not what America, the principles that America was built upon. I'm here for my daughters who are asthmatic, and I just hope that one day they will not have to face the same decision that I had to make, which is declining insurance. Thank you for your time.